Welcome to Conversations on Cancer, brought to you by the Riverside Cancer Institute, providing answers, debunking myths, and sharing patient stories.
Welcome back to Conversations on Cancer, brought to you by the Riverside Cancer Institute. I'm your host, Gabby Cinnamon, and today, Karen Verrill, an oncology certified nurse practitioner at the Riverside Cancer Institute, is joining us to talk about chemotherapy. Thanks so much for joining us today, Karen.
Thanks, Gabby, for having me today. I really appreciate coming today.
Yes. So before we get into today's topic, can you kind of tell me about why you decided to become an oncology certified nurse practitioner and, your background?
Sure. So originally I had started out in oncology. So I've been in oncology for 36 and a half years right now.
That's awesome.
So I transitioned from a staff to an advanced practice nurse and then as a nurse practitioner. And I've been actually a nurse practitioner in oncology for the past 23 years. I've been here at Riverside at the Cancer Center for the last 12.
Oh, so you have a lot of experience.
I do. I've seen a lot of things change and evolve, which have been very positive in cancer treatment. When I first started, things weren't as positive as it is today.
Yeah, I'm sure that's really exciting to, see outcomes improve with technology and advancements. Very cool. So what is chemotherapy?
So chemotherapy is actually a cancer treatment that we use to treat cancer. It's in addition to surgery and radiation, but essentially it's drugs that are used to destroy the cancer cells.
Are there different types of chemotherapy?
Yes, there are different types of chemotherapy that are used. Different diseases have different types of drugs. So dependent upon what your disease is determines what we're going to use to treat your disease.
So with those different types, how is chemotherapy administered, and can it be administered in different ways?
Sure. So chemotherapy, it can be given in a lot of different ways, but primarily the main two routes that they are given or ways that they're given is actually intravenously. So it means it goes through your vein. And then there's also the oral. So it's like a pill.
You kind of mentioned, getting a treatment plan and, when a patient is diagnosed, they'll get a treatment plan. When might chemotherapy be prescribed as part of a patient's treatment?
Sure. So after the patient actually has their diagnosis, they'll meet with a medical oncologist that determines what's the best treatment for their disease. And it's at that time where they'll determine, is chemotherapy indicated, is radiation indicated, and or surgery. It could be all three. It could be just one of those things.
Oh, wow. Okay. So kind of when you first started talking about your experience so far, you mentioned how it's been really awesome, cool to see how treatments have advanced over the years. Has chemotherapy also changed over the years and improved?
Absolutely. I think what I always tell patients is when I first got into oncology, we'd see maybe one or two new drugs a year. Now you're seeing one or two new drugs, maybe 2 or 3 times a month. I mean, It's phenomenal what is happening.
That's very cool. So, obviously, the internet is a good thing. You can go out there and search, different medical terms and diagnoses, but that can also be kind of scary, I'm sure, because if a patient is told, that they need chemotherapy, they'll go out there and look it up. And kind of what are some of the misconceptions that you hear that patients might find on their own and come and talk to you about? What are some of those common ones?
Sure. I would say the most common one is everybody thinks they're getting the same drug, and that's not the case by any means. Everyone thinks when they get chemotherapy, they're going to lose their hair. They all think that they're potentially going to be nauseated or throwing up, and that's not the case either. So we always encourage our patients to seek out reliable sources on the internet to help them in terms of seeking the information that they're trying to find.
Yeah. So it sounds like, everyone can have a different experience with chemo, and it's not one size fits all. And just because someone who had that side effect, you may not have that same side effect as well.
That's correct.
What are some of the side effects that, patients should be aware of, or that you tell patients are common side effects of chemotherapy?
So the most common side effects that we see with patients are those that are affecting the fast growing cells, because that's what chemotherapy is actually trying to destroy. So in turn, we're getting some of those healthy cells. So we're looking at the cells that are produced in your bone marrow. So that's why we always tell people that you're at risk for, in fact, you're at risk for bleeding. So those are some very key important components in terms of those affecting your bone marrow. Other cells that are divide the quickest in your body are actually your hair. So that's why some of our agents do cause hair loss. It also affects your GI system, so including your mouth, stomach. So some of the GI effects that we see in patients that affect where they may be nauseated, they may have diarrhea, constipation. You see those effects also, and that's just, again, because those cells in your GI system are affected.
Is there anything, patients can do to work with their oncologist to combat these side effects from chemo?
Sure. So the biggest thing is, and I really stress this with patients, is if they have a question, they have to call us. There is no way that patients can remember everything that we're told to them when they were first here to go through their treatment plan. We give them information that they go home with, but sometimes, it's a very overwhelming situation for patients. And so I always tell them, I don't care, if you can't remember if you're supposed to do A or B, I want you to call us because I'd rather you call us and we can address that issue that you have.
Yeah, no, that's very good advice. And I'm sure it puts them at ease too, to be hearing that. And going through what you said, through their chemotherapy and cancer journey, they form a relationship with their oncologist because they're seeing them frequently for treatment. What kind of words of encouragement do you give patients who have been prescribed chemotherapy? And, what tips do you give them?
Sure. So, again, every individual responds differently. And, there are days that are tough, but again, letting us know how we can help you, whether it be with side effect management, personal issues that you're being confronted with, work issues. We're here to help you.
Yeah.
So it's a journey, truly. And we walk that journey with you. So we want to make it as easy as possible for you.
Yeah, I'm sure that's really helpful, knowing that someone's by their side throughout. Is there anything else we should know about chemotherapy?
Again, it continues to evolve, and the types of drugs that we're using for many of these cancers that we see, it continues to change over and over again. And that's what the exciting part is. So there's lots of hope, there's lots of promise, and we're here to help you as we fight this disease with you.
That's great. Thank you so much. I think that that's a really good place to end off on a positive light because, I feel like sometimes there can be a negative connotation with chemotherapy. And I'm sure, it can be scary when you're told, oh, you need chemo, or as we talked about, there's so much information out there. Someone that might have had a different outcome or a different side effect. So it sounds like as time goes on, hopefully things get even better and the outcomes improve even more. So thank you so much for sharing that with us.
Oh, absolutely. My pleasure.
Yes. And thank you, listeners, for tuning into the Conversations on Cancer podcast brought to you by the Riverside Cancer Institute. For more information about chemotherapy and the Riverside Cancer Institute, visit riversidehealthcare.org/cancer.